Hi, I'm Eddie. I'm going to be doing the newborn assessment. So first, I'm going to wash my hands because I don't want to be touching a baby with dirty hands. I'm going to clean my stethoscope, clean. So when I get the baby, the first thing I'm going to do is I'm going to warm and dry the baby. I'm going to put him down. I'm going to like wrap him with the blanket or whatever. They have there. It's usually like a sheet, I think, because you like after you do that, you like get the sheet and throw it away because it's wet, and then you get another sheet. So then we're gonna want to look at the APGAR, kind of do the APGAR. We want to look for pink. Um, Most babies usually get acrocyanosis because the lung is getting oxygen to the main parts, which is like the torso and the head. You want to look for crying, activity, and all those things that come with APGAR. Usually they'll be just like moving around, and you want to get the heart rate. The heart rate is usually going to be between 110 and 160. It's irregular, so it just like kind of bounces up and down a lot. You're going to want to get the heart rate. You can get the heart rate through the umbilicus, like you can like grab it like that and it'll be pulsating. So we're going to get the heart rate. And Harold said if someone's like another practitioner is over there counting, you can like do that little tapping so the other practitioner can see how many counts there is. So his heart rate is 134. We're going to get his weight, his length, and his height. We're just going to be doing the measurements overall because that's what the parents care about. And like Harold said, we're going to be doing it in both ounces, pounds and ounces, and kilograms. We do them in pounds and ounces because that's what the parents care for, but we're looking for kilograms. And when it comes to the length, we're going to do it in inches, but we care for the centimeters. So we weigh the baby, and the baby weighs 7 pounds, 6 ounces. And we're gonna do the length. So we're gonna measure the length like that. Then after that, we're going to get the circumference of the head. And we're gonna get the circumference of the chest of the baby. So then we're gonna do the vitals. I already got the heart rate. You can do the respirations. The respirations, you kind of just want to like look at the baby's chest or abdomen and see like how many times it's going up and down. You want to get their temperature. You don't want to do it rectally because you can damage the tissue. So you do it axillary. Then you're going to auscultate the bowel sounds. Babies do have bowel sounds, so you just want to listen for them. And also when you're like auscultating these kind of things like the heart rate and the respirations, you want to do it for a whole minute because their heart rate is irregular, like I said. Then we're going to look at the skin. We want to look at the texture. Babies have very smooth skin. You want to look at the color, see if it's okay for their race, and then you want to look at the vernix. You really don't want to rub off the vernix because it like kind of helps them out. And you're also going to look for other things such as like little red spots, Mongolian spots, I think that's what they're called. You just want to document these things. If the baby looks like it has acne, that's normal. Don't go popping the acne. We're also going to be looking for all the reflexes. You know, the one where you turn the baby's head and he'll turn like his whole body. And then you do the reflex. Like you just want to see if they're active. So you do that reflex where you hold it like that and you kind of drop him to see. You can snap, but honestly, I think I'd rather do the like drop the baby. And then you want to do the sucking. You put your finger, like with the glove on, you put your finger in the baby's mouth and you just check the, like to feel for the sucking. You want to look at the eyes. The constriction of the pupil is going to be a little hard to tell because their eyes are kind of swollen, and then babies get their erythromycin antibiotic in their eyes, so then it's going to be even harder to tell. You want to look for the sucking, the constriction, and there's the, what other one am I missing? Oh, you want to do the J on the leg, on the foot. The baby's toes should like do this. So I don't know the other reflexes. Okay, so then you want to do the head to toe assessment. This is where you're going to start. Like you're just gonna start assessing the baby. You're gonna be assessing the cone head. Because the baby's like fontanelles are soft and they're being squished through the canal, so their head is going to be looking a little like large. You want to tell the parents that that's normal, that should go away. You also want to be looking, that can be like to hematomas, but it goes away eventually. Then you want to look at the damage on the cheeks because of the forceps. Like if the baby is a forceps delivery, the forceps like kind of like get on their cheeks. So you want to check for any lacerations or anything on the cheeks. You also want to check if they were like delivered via vacuum. You just want to check on their crane, their occiput, or yeah, around here. So the next thing you're going to check is the face. You want to make sure it's symmetrical. That's what you're really looking for. You're also going to check the nares because babies are primarily nose breathers. So you just want to put like one finger on one nair and just make sure that the other one's patent. You just want to make sure for patent nares. You're gonna do the hearing test. All babies get hearing tests done before they go home because they're like, you're not gonna know if they have a hearing problem until if you don't do the test, they're not gonna know they have a hearing problem until they start talking, which is like later on. So they do the test so they can like get an early interventions going. You're also gonna do the eyes. You want to check for symmetry, like I said. You want to check the sclera. You want to check the pupil constriction or dilation. You want to check the cornea. You're just gonna be checking for all those things. You can get the I think it's the otoscope. I'm not sure that's for the ears, but you're also going to check the conjunctiva by putting the little eyes on, making sure they're pink. Let's see. You're gonna check the neck. Babies' necks are very strong. Apparently, you can get them by the head and do this, but you shouldn't. You want to make sure for their breathing, that they're breathing easily and that they're not using accessory muscles. Babies, yeah, you don't want them like using their chest to breathe. You don't want like to see pursed lips, and you don't want to just see like that kind of bigger chest diameter. I was gonna say, so babies when they are born, since they were in the amniotic fluid, their lungs are filled with fluid. So it should start going away. The fluid should start going back into the vascular access. You want to measure the nipples. Measuring the nipples can really tell you how old they really are. That really helps doing that. You want to listen to the bowel sounds like we did earlier. Like I said, babies do have bowel sounds. And you also want to check the umbilicus. The orange jelly does start to constrict towards the end. Later on, you can palpate the pulse through the umbilicus too. You also want to look at their genitalia. If it's a girl, you just want to look. You're not gonna be able to really see anything because they're still kind of young, but you do like check for a little bit of bleeding, probably because due to hormones. And then if it's a male, you want to check their urethra and make sure that the urethra is at the end of the penis and not like under it, because that's a defect. You also want to check for rugae on the scrotum, because the rugae also tells you like the age more accurately, because the older they are, the more rugae there is. Okay, so when it comes to elimination, they're going to have meconium poops for the first like 2 or 3 times. And then when they start breastfeeding, it's going to be like a watery poop. It smells sweet. So once you start getting more like formula into the baby's diet, that's when you're gonna start seeing a more formed poop, and it's gonna smell more too. But yeah, when it comes to like them feeding or them breastfeeding, the milk just goes right through them. So as soon as you start breastfeeding, you're gonna expect to see like a wet diaper. There's some acrocyanosis too, like we were mentioning, like I said earlier, since the body's like it's early on, like their body's gonna be getting blood more to their torso and more to their head instead of their arms and their legs. So that's why you might notice some blue. There's gonna be some jaundice also. That's normal. Physiologic jaundice is normal. Pathologic jaundice is not. So that's when you get them under the UV light, or you'd want to get them pooping so they can like start flushing it out. And then there's blanching. You can blanch like on the head, on the chest, and just make sure that like blanching is occurring. And yeah, that's my newborn assessment.